You've been doing everything right. You take your medication. You cut back on salt. You watch what you eat. And yet, somewhere around your late 50s or early 60s, your blood pressure numbers started creeping up again, or they got harder to control than they used to be. Maybe your doctor added a second medication. Maybe the dose went up. Maybe you passed your last few checkups feeling a little unsettled, wondering what changed, wondering why your body seems to be working against you even when you're working so hard to stay healthy. Here's what almost nobody tells you. That's not a personal failure. That's biology. And the biology has a very specific explanation, one that most routine doctor appointments don't have time to cover, and one that changes everything about how you should be approaching your cardiovascular health right now. After the age of 60, your blood pressure doesn't just become harder to manage by accident. There are actual structural and hormonal changes happening inside your arteries, your kidneys, your nervous system, and your brain, changes that are predictable, well documented in the research, and this is the part that matters, partially reversible with the right interventions. Not all of it is reversible. Some of it is the honest work of aging, but a meaningful portion of it responds directly to specific lifestyle choices, and most people over 60 are not making those choices because no one has ever explained to them why those particular choices matter at this particular stage of life. That's what this episode is about. By the time we're done, you're going to understand the actual mechanisms behind age-related blood pressure changes. In plain language, not jargon. You're going to understand why the strategies that worked in your 40s may need to evolve now. And you're going to walk away with concrete things you can do, starting this week, that are specifically calibrated to what your body is doing after 60. If you find this kind of evidence-based, practical information useful, take a second right now and subscribe to this channel. We release new episodes every week covering blood pressure, heart health, and a lifestyle science that most people never hear from their doctors. Not because doctors don't know it, but because they have 12 minutes with you and a prescription pad. Hit the like button too, because it helps more people who need this information find us. Now let's get into it. The first thing you need to understand is what happens to your arteries as you age. And I mean specifically, physically, mechanically, what happens inside the walls of those vessels. When you were young, your large arteries, the aorta, the major vessels leading away from your heart, were elastic. Think of them like rubber bands that have been sitting in a cool drawer. Flexible, responsive, able to stretch and recoil. Every time your heart pumped, those arteries would expand slightly to absorb the force of blood moving through them. Then they'd snap back, keeping blood pressure in a normal range during that brief pause between heartbeats. That elasticity is not a luxury. It is a pressure buffer. It is your body's built-in shock absorber for cardiovascular force. After 60, that elasticity has been significantly reduced in most people. The medical term is arterial stiffness, but forget the term, just hold on to the concept. Your arteries are stiffer than they used to be, not because you did anything wrong necessarily. Because of a combination of factors, decades of normal mechanical stress from the heartbeat itself, changes in collagen and elastin proteins that make up the arterial walls, calcium deposits that accumulate gradually in vessel tissue, and the influence of hormonal changes that we'll come back to in a moment. When your arteries are stiffer, they can't absorb the force of each heartbeat the way they used to. That force has to go somewhere, and it goes directly into your systolic pressure, the top number on your reading. This is why isolated systolic hypertension, which is when only the top number is elevated while the bottom number remains relatively normal, becomes dramatically more common after age 60. Research published in cardiovascular journals has consistently shown that the majority of high blood pressure cases in adults over 65 are of this type. The stiff artery is the primary driver. Now here's the part that gets interesting and actionable. Arterial stiffness is not a one-way door. It's not irreversible in the way that, say, a scar is irreversible. Research over the past 2 decades has established that arterial stiffness responds measurably, significantly, to specific lifestyle interventions. Aerobic exercise is the most potent one. Not just any movement, but sustained rhythmic cardiovascular activity. Walking briskly, cycling, swimming, performed consistently over weeks and months. Studies have shown measurable reductions in arterial stiffness markers in older adults who engage in regular moderate-intensity aerobic exercise. The arteries don't return to the elasticity of a 30-year-old, but they become meaningfully more compliant than they would be in a sedentary person of the same age. That translates to lower systolic readings. Dietary nitrates are another lever on this mechanism. Nitrates found in vegetables like beets, leafy greens, and arugula get converted in the body to nitric oxide, a molecule that causes blood vessels to relax and expand. In older adults, nitric oxide production declines naturally, which is part of why vascular tone increases with age. Restoring some of that nitric oxide signaling through dietary sources is a genuine, evidence-backed approach to supporting arterial health. This isn't folk medicine. This is a well-characterized biochemical pathway. The second mechanism, and this one surprises most people, involves the kidneys. Your kidneys regulate blood pressure through something called fluid and sodium balance. In simple terms, your kidneys decide how much sodium to hold on to and how much to excrete, and that decision directly controls how much fluid stays in your bloodstream and how much volume your heart has to push through those arteries. More sodium retained, more fluid, more volume, more pressure. When you were younger, your kidneys were remarkably good at this regulation. After 60, several things change. The kidneys themselves have less functional tissue, a natural part of aging, which reduces their efficiency. The renin-angiotensin-aldosterone system, which is the hormonal loop your body uses to control sodium and fluid balance, becomes increasingly active with age. And critically, older kidneys become more sensitive to sodium, meaning the same amount of dietary sodium that your body handled without much trouble in your 40s produces a larger blood pressure response in your 60s. This is why the same salt restriction that didn't seem to matter much when you were 45 can make a real difference at 65. The mechanism has changed. Your sensitivity has changed. The research on sodium and blood pressure shows a clear age gradient. Older adults respond more robustly to sodium reduction than younger adults do. So if you tried reducing sodium years ago and didn't see a dramatic effect, that's worth revisiting now. The body you're working with is more responsive to that intervention today than it was then. There's also a hydration dimension to this that almost never gets discussed. Many older adults are chronically mildly dehydrated. Not dramatically, not dangerously, but enough to affect kidney function and blood pressure regulation. The thirst signal weakens with age. You genuinely don't feel as thirsty as you should, even when your body needs water. And mild chronic dehydration prompts the kidneys to retain even more sodium and water in an attempt to maintain blood volume, which, paradoxically, can contribute to elevated readings. Drinking enough water, plain water, consistently through the day, not waiting until you feel thirsty, supports kidney function in ways that most people don't connect to blood pressure. This is one of those simple, zero-cost interventions that gets overlooked because it doesn't feel medicinal enough to be real. It is real. The third driver of age-related blood pressure changes is the nervous system, and specifically a component of it called the autonomic nervous system, which handles all the automatic background functions of your body: heart rate, digestion, vessel tone, breathing regulation. Within the autonomic nervous system, there are two counterbalancing branches. The sympathetic branch is your accelerator. It speeds things up, raises heart rate, constricts blood vessels, raises blood pressure. The parasympathetic branch is your brake. It calms things down, lowers heart rate, widens vessels, lowers pressure. In a healthy, younger body, these two branches stay in dynamic balance, constantly adjusting to whatever you're doing or experiencing. With age, this balance shifts. Research shows that baseline sympathetic nervous system activity tends to increase in older adults. Your accelerator is running a little hotter than it used to. This contributes to higher resting vessel tone, higher baseline heart rate variability, and yes, higher resting blood pressure. And it means that stress, which further activates the sympathetic branch, has a larger blood pressure effect on an older adult than on a younger one. This is why stress management becomes more than a wellness suggestion after 60. It becomes a cardiovascular priority. And the interventions that modulate sympathetic tone are specific and evidence-supported. Slow, diaphragmatic breathing, breathing from the belly, with a longer exhale than inhale, directly activates the parasympathetic nervous system. Studies have shown that device-guided slow breathing and practice breath control can produce meaningful reductions in blood pressure in hypertensive adults. You don't need a device. You need to slow your exhale. Mindfulness-based practices, yoga, tai chi, these have accumulated genuine research support in the context of blood pressure management in older adults, specifically because of their effects on autonomic balance. This is an alternative medicine. It's applied neuroscience. The vagus nerve, the main channel of the parasympathetic system, is trainable. Its tone improves with consistent practice, just as muscle tone improves with exercise. Sleep is another underappreciated lever on this same nervous system. During deep, restorative sleep, blood pressure naturally dips, sometimes by 10 to 20%. This dip is called the nocturnal dip, and it's an important part of cardiovascular recovery. Research has consistently associated non-dipping patterns, where blood pressure doesn't fall adequately during sleep, with worse long-term cardiovascular outcomes. After 60, sleep architecture changes. Deep sleep stages shorten. Sleep disorders like sleep apnea become more prevalent, and many adults are simply not getting enough total sleep. If your blood pressure readings are consistently higher than expected despite appropriate management, sleep quality is worth taking seriously as a clinical variable, worth mentioning to your doctor explicitly, and worth investigating with a sleep study if symptoms suggest it. Untreated sleep apnea, in particular, has a direct and well-documented connection to blood pressure that is often undertreated because the two issues are managed in separate clinical contexts and don't always get discussed together. Before we continue with the next major mechanism, and there are two more I want to walk you through, I want to take a moment to check in with you. If you've been watching this channel, and this kind of in-depth explanation is what you came here for, please hit subscribe if you haven't already and tap the like button on this video. It genuinely helps us reach the people who need this information most, and it tells us we're doing our job right. We'll be right back in the deep end now. The fourth factor behind worsening blood pressure after 60 is hormonal, and this one has different implications depending on whether you're a man or a woman. So I want to address both. For women, the decades around menopause represent a significant cardiovascular inflection point. Before menopause, estrogen exerts a protective effect on the vascular system. It supports nitric oxide production, promotes arterial flexibility, and appears to have a favorable influence on sodium handling by the kidneys. After menopause, as estrogen levels fall sharply, many of those protective effects diminish. Research has consistently shown that blood pressure tends to rise more steeply in women during the years following menopause than in men of the same age. This hormonal withdrawal contributes directly to the arterial stiffening we discussed earlier, as well as to changes in how the body handles salt and fluid. For women in their late 50s and 60s who find their blood pressure numbers climbing despite a lifestyle that hasn't changed dramatically, understanding this hormonal mechanism is important. Not to feel helpless about it, but to understand that this is a physiological shift that responds to lifestyle interventions just as strongly as, and in many cases more strongly than, the changes seen in younger adults. The estrogen is gone, but the pathways it was influencing are still there. Diet, exercise, and stress management can engage those same pathways through other mechanisms. For men, the hormonal story involves testosterone, and it's more nuanced than the popular narrative suggests. Testosterone does tend to decline gradually with age, and low testosterone has been associated in some research with increased cardiovascular risk markers. But the more important hormonal dynamic for men over 60 in the context of blood pressure is the shift in the ratio between testosterone and cortisol, your primary stress hormone. Chronic stress, poor sleep, and sedentary behavior all elevate cortisol over time. Elevated cortisol promotes sodium retention, increases vessel constriction, raises baseline sympathetic tone, and directly elevates blood pressure through multiple simultaneous pathways. The lifestyle behaviors that support healthy cortisol levels in older men, consistent sleep, regular aerobic exercise, stress reduction practices, adequate dietary protein, are exactly the same behaviors that support blood pressure control through every other mechanism we've discussed. They reinforce each other, which is why when people implement these changes consistently, the effects on their readings are often more significant than any single intervention would suggest. The fifth and final mechanism I want to address is one that operates at the level of the brain, and it's one that almost never makes it into the typical blood pressure conversation. Your brain contains a region called the hypothalamus, which functions in part as a master regulator of blood pressure. It receives signals from blood pressure sensors throughout the body, called baroreceptors, and it coordinates the autonomic nervous system response to keep pressure in range. In younger adults, this system is extraordinarily sensitive and responsive. It can detect a sudden drop in pressure when you stand up quickly and within seconds redirect blood flow to compensate. With age, baroreceptor sensitivity declines. The sensors become less accurate. The brain's pressure regulation response becomes slower and less precise. This is part of why older adults sometimes experience orthostatic hypotension, a sudden drop in blood pressure when standing, even in the context of overall hypertension. The regulatory system has lost some of its precision at both ends of the range. But this central regulatory decline also has implications for resting blood pressure. A less precise regulation system tends to allow higher baseline pressure to persist without triggering the compensatory responses that would bring it down. The brain's set point, in a sense, drifts upward. Some research has suggested that this central recalibration is one reason why blood pressure medications that work through the sympathetic nervous system are often particularly effective in older adults. They're working at the level of the same regulatory machinery that has shifted. From a lifestyle perspective, the most relevant intervention here is again aerobic exercise, specifically because consistent cardiovascular training has been shown to improve baroreceptor sensitivity. It recalibrates those pressure sensors. The brain becomes better at detecting and responding to pressure changes, and that improved regulation can contribute to lower resting readings over time. There's also growing research interest in the gut microbiome's relationship to blood pressure regulation, including its influence on central regulatory pathways. This is genuinely emerging science, not settled, but the early findings are consistent with what we already know about diet. Diverse, plant-rich diets that support a healthy gut appear to have downstream effects on blood pressure through multiple pathways, including microbial production of compounds that influence nitric oxide and inflammatory signaling in the vascular system. The practical implication here is not to run out and buy probiotic supplements. It's to eat more plants, more vegetables, more legumes, more whole grains, more fiber. Not because of any single nutrient, but because of the accumulated effect of a plant-dense diet on every single mechanism we've discussed in this episode. Arterial stiffness, sodium handling, autonomic balance, hormonal regulation, and now central nervous system precision. The pattern of eating matters more than any individual food. Now let's talk about what you can actually do, not in theory, but this week, this month, and the next 90 days. The first practical priority is getting honest about your aerobic movement. Walking counts. Swimming counts. Cycling counts. The research is not pointing toward intense exercise. It's pointing toward consistent, sustained, moderate intensity aerobic activity. The target that most cardiovascular research uses as a threshold is 150 minutes per week of moderate aerobic activity. That's 30 minutes, 5 days a week, or 45 minutes, 3.5 days a week. However you slice it. If you're not close to that right now, don't try to get there in a week. Start with what you can do without pain or major effort. 10 minutes, 3 times a day, adds up to 30 minutes. Studies have shown that accumulated bouts of shorter activity produce cardiovascular benefits comparable to a single longer session. The body doesn't check the clock. It responds to the total stimulus. The second priority is revisiting your sodium intake, not through willpower and restriction, but through substitution and awareness. The dominant source of sodium in the American diet is not the salt shaker. It's processed and packaged food, bread, canned soups, deli meats, condiments, restaurant meals, and fast food. A single deli turkey sandwich from a typical American restaurant can contain more than 1,000 milligrams of sodium. The general recommendation for adults with elevated blood pressure is to stay under 1,500 milligrams of sodium per day. Most Americans consume between 3,000 and 5,000. You don't need to count every milligram. What moves the needle is cooking more of your own food, choosing lower sodium canned goods when you use them, rinsing canned beans and vegetables before use, and replacing the salt shaker on the table with other flavoring tools: herbs, citrus, vinegar, spices. None of these require suffering. They require habit adjustment, which takes about 3 weeks to feel normal. The third priority is water. Plain, consistent water intake throughout the day. The old guideline of 8 glasses a day is imprecise, but not far off for most people. What matters is not letting yourself get into even mild dehydration, which, as we discussed, prompts your kidneys to respond in ways that raise pressure. Start your morning with a full glass of water before coffee. Keep water visible and accessible through the day. Don't rely on your thirst signal to tell you when you need it, because after 60, that signal is less reliable than it used to be. The fourth priority is sleep. Real sleep, adequate sleep, regular sleep. 7 to 9 hours for most adults is the research-supported target. If you're regularly sleeping fewer than 6 hours, you're carrying a cardiovascular load that no other lifestyle change fully compensates for. If you suspect you have sleep apnea, if you snore heavily, if you wake up tired even after 8 hours, if your partner has ever told you that you stop breathing briefly at night, talk to your doctor about a sleep evaluation. This is not an optional consideration. The fifth priority is breathing. I know this sounds almost too simple to include in a serious medical discussion, but the research is not ambiguous. Practicing slow, controlled breathing, particularly with an extended exhale, activates the parasympathetic nervous system, reduces sympathetic tone, and produces acute and, with consistent practice, sustained reductions in blood pressure. 5 to 10 minutes a day. Inhale for 4 counts. Exhale for 6 to 8. That's it. Do it before bed. Do it during a stressful moment. Do it when you first wake up. The mechanism is real and the cost is zero. Here's the summary of what we've covered today, and the thing I want you to hold on to. After 60, blood pressure doesn't get harder to manage because you're losing. It gets harder to manage because 5 separate physiological systems are simultaneously shifting. Your arterial walls are stiffer, your kidneys are more sodium sensitive, your autonomic nervous system is running hotter, your hormonal landscape has changed, and your brain's pressure regulation system has recalibrated. Every one of those shifts is real, and every one of them responds. Not completely, not magically, but meaningfully and measurably, to consistent lifestyle behaviors that most people either don't know about or haven't yet connected to these specific mechanisms. That connection is everything. Once you understand why aerobic exercise matters at 60 in a way that goes beyond vague heart health advice, once you understand that it's literally restoring the flexibility of your arterial walls and recalibrating the pressure sensors in your nervous system, it stops feeling like a chore and starts feeling like medicine. Because that's exactly what it is. The single most important thing you can do after watching this video is decide on one of the 5 priorities we discussed and make a specific plan for the next 7 days. Not all 5. 1. Which one can you realistically improve this week? Write it down. Tell someone. Make it concrete. Your numbers are not fixed. Your body is still responding. The research is on your side.